Varicoceles are very common, and they are not dangerous. In fact, 15% of all adult men have a varicocele. For many men, their varicocele will go unnoticed throughout their life, or will not cause any problems at all. About 20% of adolescents have varicoceles, so a fraction of them likely resolve spontaneously. In this video, we will talk about this disease, varicocele, by answering these questions. What is varicocele? What causes varicocele? Symptoms of varicocele. What problems are associated with varicoceles? What is the grading system for varicocele size? How is it treated? What is varicocele? A varicocele is an abnormal dilation and enlargement of the scrotal venous pampiniform plexus, which drains blood from each testicle. Varicoceles are similar to varicose veins. Varicose veins cause veins in your legs to swell and lose their shape. Varicoceles aren't life-threatening. However, a varicocele can be very serious if you're trying to have a biological child due to low sperm production. What causes varicocele? The testicles receive oxygen-rich blood from two testicular arteries, one artery for each side of the scrotum. Similarly, there are also two testicular veins that transport oxygen-depleted blood back toward the heart. Within each side of the scrotum, a network of small veins, pampiniform plexus, transport the oxygen depleted from the testicle to the main testicular vein. A varicocele is the enlargement of the pampiniform plexus. The exact cause of a varicocele is unknown. One contributing factor may be the malfunction of valves inside the veins that are intended to keep blood moving in the right direction. Also, the left testicular vein follows a slightly different path than the right vein, a path that makes a problem with blood flow more likely on the left. When the oxygen-depleted blood gets back to the network of veins, they widen, dilate, creating the varicocele. Symptoms of varicocele. Varicoceles usually don't have any symptoms. However, you may notice dull testicular pain or aching in your scrotum, which often gets better when you lie down, swelling in your testicles or scrotum, shrinking in your testicles, testicular atrophy, inability to achieve pregnancy after at least a year of trying, infertility, a small lump above your affected testicle. What problems are associated with varicoceles? Having a varicocele can make it difficult for your body to regulate the temperature of the testicles. This leads to three main problems: impaired fertility, decreased testosterone production by the testis, or scrotal discomfort. In some cases, varicocele can cause azoospermia, or the complete lack of sperm in the ovule. What problems are associated with varicoceles? Having a varicocele can make it difficult for your body to regulate the temperature of the testicles. This leads to three main problems: impaired fertility, decreased testosterone production by the testis, or scrotal discomfort. In some cases, varicocele can cause azoospermia, or the complete lack of sperm in the ovule. What is the grading system for varicocele size? Healthcare providers use grades to detect and score varicoceles. Grade 0. This is the smallest type of varicocele. Your provider can't feel it during a physical exam, but they can see it on an ultrasound. Grade I. Your provider can't see the varicocele, and they can only feel it when you perform the vulva maneuver. Grade II. Your provider can feel the varicocele even when you're not performing the Valsalva maneuver, but it's still not visible. Grade III. This is the largest varicocele. Your provider can clearly see and feel it. A varicocele often doesn't need to be treated. For a man experiencing infertility, surgery to correct the varicocele may be a part of the fertility treatment plan. There are three categories of approaches. With varicocele embolization, small coils are introduced through a vein in the groin area and are used to block the veins in the abdomen feeding the varicocele. The long-term success rate seems to be slightly lower compared to an open surgical approach, and treatment can take more than one procedure. However, there is no incision, so we often strongly consider this approach for children. In addition, it is sometimes used in patients with a previously failed surgical repair. Pain is the main indication for surgery, and body features that increase the risk of surgery such as morbid obesity. In laparoscopic varicocele ligation, a camera and small instruments are introduced to the abdomen, where the veins feeding the varicocele are clipped. This procedure also has lower long-term success rates. In addition, although complications are rare, when they do occur they can be far more serious than other approaches. Finally, the rate of hydrocele, collection of fluid around the testis, after surgery is higher with this approach. Finally, there are multiple open surgical approaches. For most patients, we perform a microsurgical subinguinal varicocele ligation. This approach yields the highest success rates and lowest complication rates, has the lowest cost, and essentially eliminates the risk of dangerous intra-abdominal injury. Thank you for listening to all the information we want to introduce to you in this video. Do not forget to like, share and subscribe for the HeInfo channel.